It is a wonderful thing to see doctors who want to break free and try and figure out how to do it and to join together and look at opportunities for taking back the practice of medicine and getting back the patient-doctor relationship where it belongs. Our organization is Citizens Council for Health Freedom. We are in our 20th year. I am a co-founder of that organization as well as the president of it. And I am, our organization is, I'm sorry, I just forgot the mission for a second. You gotta love that, right? Because we changed it. So our mission is to support and protect healthcare choices and patient privacy. And patient privacy is so important because data is a tool of control. And you can see that across your practices with all the reporting, et cetera. And so patient privacy is less about privacy. Lots of people don't think there's anything in their medical record, and maybe there isn't, that would actually harm them in a privacy type of way, but it could certainly harm them when it comes to who has control over the medical decisions of their lives. So my topic for today is why engaging grassroots and targeted activism is important. So let's just look at the basics. So the basics is that healthcare is all about patients and patient care. I mean, if there was no patient, we wouldn't need you, right? So if the healthcare system doesn't work for the patient, then it doesn't work. Then you've got to wonder, who's it working for, right? And it's working for a lot of people who are not the patient. So patients are vulnerable, as you all know. Medicare, Obamacare, HMOs, ACOs exploit that vulnerability for their own purposes and agenda, and they aim to seize control of the patient-doctor relationship and your hands as doctors and change what happens to meet their own agendas. So patients come to the doctor in pain, and they trust that the doctor has their best interests in mind. But policymakers, big health profiteers, government officials, and proponents of population-based bioethics are twisting the patient-doctor interaction to their own advantage. And their agenda has nothing to do with patient care, good patient care, any kind of patient care. It all has to do with different agendas. So depending on who they are, their agendas are focused on the next election, securing a lucrative career after they get out of office, securing a cozy contract with the government, consolidating power and profits, and making more money, and making sure that money is not wasted on the unproductive or the invaluable. Those are their agendas. Well, in this environment where the weak, the sick, the mentally ill, the elderly, and the most vulnerable can find themselves in treacherous waters, the very integrity of the American medicine is in dire jeopardy. So the big guys have risen up against the little guy. So what's the little guy to do? Well, we have a lot of little guys in this country. We have an army of little guys. If we could just get them to understand what is happening and what's going to happen to them and what they think is the excellence of medicine in this country. And how it's all changing, but they don't really know yet. So the little guy has to stand up and fight while the battle can still be won. Big government and big health are counting on people being busy and disengaged in policy, and that includes you. They plan for you to be very busy in your offices, figuring out all those regulations, reporting all that data, and making sure you never get to Congress and never talk to anybody who could help. So to protect patients, and to preserve medical ethics and to restore health freedom, we must all engage wherever we are, with whatever skills we have, with whomever we run into, and that includes your patients. So our organization knows that an informed people is more likely to be an engaged people. So if you don't know what's going on, you have no reason to act, which is why a lot of the little guys aren't acting. So our power as an organization comes from the people. The fact that we have people who, when we call on them to act, they actually do. And otherwise, me being anywhere, saying anything, wouldn't really matter, because as far as legislators go, I would have no power. But when they got people calling who are their constituents saying, what are you doing down there, then it matters. So for instance, in one case, I had talked to a legislator 3 times, testified against his bill 2 times, and then his bill came up for the committee right before it was going to go to the floor. And I said, okay, that's enough. And I called out the troops. And that morning at 8 o'clock, he stood in front of the committee and he withdrew his bill. And he said, and I apologize for your inboxes this morning. But it's all because of the people. You could see I had no power until I engaged the people. So we engage the people and by our weekly e-news, which is nationwide, by a legislative report, by special action alerts, by Health Freedom Minute, which it's a radio program in 40 states on 348 stations, and we give opportunities to testify or to write public comments. So on national issues, not just here in Minnesota, but on national issues, you know, something that HHS has proposed or the IRS has proposed, but we know that we can just ask you to say a very simple statement and build up the number of comments that are opposed to it. We have some action campaigns, including Refuse to Enroll, petitions, our exchange opt-out, our baby DNA card. So on your table you have baby DNA cards. This is really important. The federal government has given $25 million to create genomic sequencing, so the sequencing of the entire DNA of the child for newborn screening. All part of a government record, the entire DNA laid out there. So it's really important to let your patients know about what your state is doing with newborn screening. Are they keeping the DNA or aren't they? This is a campaign. This is an important campaign, a way that you can engage your patients, especially those who are pregnant. Have them check our website, itsmydna.org. We have a page for what all 50 states are doing on baby DNA, how long they keep it. Because genetic privacy, imagine what a government could do when they find out what's in your DNA. And they put it together with different things, and they find different reasons for it. And then we have our HIPAA refuse form, which we encourage people not to sign the HIPAA form. I hope that you as doctors will tell people they don't have to sign that form. I hope that you have forms that are not bundled consent forms, where you have treatment, payment, the electronic medical record, research, all on one and only one signature. If you have that, I encourage you to put a signature under each one of them. Make sure there's a signature under the HIPAA form, and you can even put in there, you're not required by law to sign this, and this allows people to keep their right not to sign the HIPAA form. So there are key policies that protect patients and doctors. I'll just give you a few of them. I want you to know that the basis of where we operate at is called a wedge of freedom. So we know that we must keep in this country a wedge of freedom. So if you think about a circle, we want a piece of it. And it's always a place that is free. And so every policy, every way we think is how do we preserve the wedge of freedom where patients and doctors are free to interact together, and where everybody else who's outside of the wedge of freedom can realize, maybe I can go there. And then maybe we can build the wedge of freedom. Right now, the wedge of freedom is getting squeezed smaller and smaller and smaller, but we have to keep a wedge of freedom and then build it up. So some of the policies that we would encourage, if we look at some of the tools of tyranny. So we always go to why are we where we are, and what are the policies that could attack that? So data is one of them. Data is a tool of tyranny. Surveillance is a tool of tyranny. Getting into your medical record, profiling you, profiling your patients, then giving you a black mark because you didn't do what you were supposed to, you didn't comply with X, Y, Z. And so consent rights over the sharing of data, maybe giving patients the right to have a paper medical record, or to have a record that doesn't ever leave the clinic, so it's not connected outside. A right of consent over the linking of their medical records, a right of consent over getting on a state health information network. We want to undo HIPAA. We want to get rid of HIPAA. HIPAA and high-tech together give 2.2 million entities and all the people in there access to your medical records. That is a federal agency number. So, and we need stronger state laws to be enacted. So go to your legislators and say, we understand that HIPAA, which lets all these people have access to data, that if there's a stronger state law, that's what everybody in this state has to do. So let's put in some consent requirements. Let's make sure patients have consent rights and doctors have consent rights. You just can't share my data because I'm a doctor. I get to consent whether you can share my data, and let's get some state laws like that. Another thing that is a tool is the centralized systems and centralized standards. So Obamacare Exchange. So we have focused on the Obamacare Exchange because it's the Achilles heel of Obamacare. The Achilles heel, so it can be attacked. We call it the IRS Enforcement Center, the Obamacare Funding Center, the Insurance Surveillance Center. It is the central heart of Obamacare. And if there are not enough people in it, it is not sustainable. If the House refuses to fund the federal one, it is not sustainable. If people leave it, if they disenroll, it is not sustainable. If you want to stop Obamacare, you make the exchange unsustainable. So we have our Refuse to Enroll campaign and our Disenroll campaign. You can talk to your patients about why they shouldn't be in Obamacare. You can get our one-page flyer and make it available. We also would like policies to, one thing that was talked about today was surgical centers, independent surgical centers. We have testified for oftentimes against the hospitals who want to prevent independent surgical centers from existing, right? We need to have them as competition, and we need to have them even for safety and health reasons. People who have cancer should not have to go into this huge place. They should be able to go to a cozy little place with a parking lot, and they just walk in and people know their name, right? There are reasons, including competition. And then the third one that I'll mention as for policies is policies that stop the doctor from being put under control of the government. So doctors should have to consent to do evidence-based medicine, to follow practice protocols. There should be requirements that no doctor has to follow anybody else's practice protocols. Pay for performance should go away. Quality measurement, you should have to get your patient's permission before you provide any of their data to the government to do quality measurement, which we consider compliance measurement. And computers, you shouldn't have to follow the computer protocols. I had one doctor tell me if it's not on the computer, I can't do it. Well, there's no autonomy in that. It means you don't really need you as a doctor because somebody else could press the buttons on the computer, right? So there needs to be a right for doctors to ignore evidence-based medicine. There should be no connection with malpractice in evidence-based medicine. Following protocols will get you free from malpractice. Well, that's a really bad idea. Charity care must be protected. The right to pay cash, the right to accept cash, and the right to discount prices must be protected within the wedge of freedom. There needs to be ownership of health insurance policies from life, even perhaps conception, till death, a private policy that parents can buy for you before you're even born, and then you can take over ownership of. No restraints in licensure or mandated servitude to serve Medicaid and to serve Medicare and to serve Obamacare. And then to refuse, you should, as you're all doing, considering, refuse to enroll as a participating physician. So as physicians, I'm asking you to engage your patients, because your patients think everything is fine and dandy. And a lot of them are just watching their Twitter feed, and they're not watching Fox News, and they're watching CNN, and everything is just great. But you need to be informing patients because their right to have you as a doctor on their side is being taken away from them. So I almost consider it an obligation of yours as a medical professional to not just let the medical profession slip away by not engaging patients. Patients could be the best advocates if they actually knew what was happening. So that is I guess that's my call to action is please engage your patients. On the table are items that you could use in your office. You just need to call us and ask us for any of those things that you would like to share with your patients. Let me see, I thought there was one other thing. Act now while your patients still trust you. The media is doing a lot to make sure that they don't. Act now while your patients still trust you. so that you can help everyone stay free, and you can help medicine keep its integrity, and you can help patients keep their dignity. Because all of that will go away if your patients don't understand what's happening until it's too late. One of the messages that I have been giving people is get your cash for care doctor now. Because you want a doctor who's employed by you. And you want a doctor who's on your side. So, engage your patients in this conversation. Just take a little bit of time, have something available at the office for them to contemplate, put a video on the screen if you've got one. But that's my call, is that we've got a lot of power in the people, and you have a lot of prestige still with your patients. And so I just ask you to engage them. Thank you very much.